Right, so this is a video about patient confidentiality. In terms of this research project that most of you will be working on, we're looking at confidentiality in terms of the research subjects we'll be using. But the subject matter of this video is really appropriate for any case where you might encounter the need for patient confidentiality or confidentiality of any topic or issue discussed. So the first thing we can look at is what exactly confidentiality is. So you can look up dictionary definitions if you like, but basically confidentiality means keeping private matters private, keeping them secret, not making them public knowledge, if you will. So in patient confidentiality, we're going to keep the patient matters private. So anything the patient tells you, anything you find out from your patient in a medical setting is private. It doesn't leave the room is one way to think about it. This idea of something not leaving the room can extend to research subjects or clients or anyone really who you have to have some degree of confidentiality with. So in terms of the research project, anything that goes on within the teaching room or the surveys that we look at or things like that stays just there. It doesn't go beyond. You can will yourself to forget about it, if you will, because in no way can confidential information leave the sphere of confidentiality. Another way of looking at patient confidentiality is not disclosing information in a way which could breach anonymity. So you don't want to connect the information that you get from a subject or a client or a patient in a way which could be connected with their name or their status or their place of work or any way which could maybe potentially ruin their reputation. These include things like written communications, also social media, so Facebook, Twitter, YouTube, anything like that. You want to be very careful about how you use it. And also even casual conversations, because you never know who's listening, you never know who's watching you, recording you, you never know where information from a casual conversation might go. So why is patient confidentiality or confidentiality in general important? Well, it helps us to build trust with the other person, because if you know that you're in a safe space and everything that you say in the room will stay in the room, then you're more likely to open up, which is really beneficial and what we're hoping for in this environment. It's also important to respect others. So if somebody tells you something in a confidential environment, they're trusting you to keep that to yourself, to keep that within the room, treat the information in a confidential manner, and we have to respect that. We have to respect their wishes, and we have to be careful. So most breaches of confidentiality aren't intentional. Nobody sets out to deliberately ruin a patient or a client, but it's very easy to break confidentiality unintentionally. So we'll look at some examples a bit later of how that can happen. First, though, we can look at where breaches of confidentiality might occur. So first of all, conversations, and it's very easy to leave some confidential setting and go speak to your friends, go speak to someone and let something slip. It's very, very easy to do. So you want to be mindful of that and be careful what you say to other people. Also, written communication, so emails, letters, even notes to yourself. If you keep a diary, you want to be careful where that gets, whose hands those could possibly get into. If you're dealing with confidential information. Also social media, so in the age of Facebook and Twitter, often people type and post things without really thinking about the implications of their message, so you just want to be mindful of that. Also references, if you make a reference to a person or a patient you saw, perhaps that's not the best way if you're breaching confidentiality. Also allusions, again, if you're referring to somebody maybe in a derogatory manner or in a way which breaks confidentiality, again, that's not really appropriate. That's not what we're trying to achieve. Oh, and also questions. So a big case where this occurs is if you see a patient or a client or somebody you met in a confidential setting outside of that confidential setting, and sometimes it's natural human instinct to go up to them, say hello, how are you doing, but that's not always appropriate, because that person may not want to be connected to you, especially if other people know that you are a counselor, you are a social worker, and it might lead to questions of how that individual knows you. So you want to be careful with that. Also, if you see somebody in a confidential setting that you know, I think the example here is if you see, your best friend's brother, your best friend's sister, in the clinic, and like you go through some very confidential information, and then you see your best friend later and say, "Oh, how's your brother or your sister doing?" You might have the best of intentions, but the individual you saw in the confidential setting may not have wanted their family to know that they were seeking your assistance. So again, it's a very delicate situation, and when in doubt, maybe ask one of your colleagues, ask a superior, ask somebody who's inside that sphere of confidentiality. So in terms of this research project, who can you ask? Well, anybody on the team. You could definitely ask me. You could ask maybe your partner if we're running a workshop to see how you could work around or prevent yourself from breaching confidentiality. So I can play a little game. I'm going to give you a scenario, and you can see whether you think it's a confidentiality breach or not. So the first one is, at a clinic session, Sally tells her psychologist that her nightmares are worsening. When Sally is waiting in the waiting room for a friend to pick her up, presumably, she hears her psychologist telling one of the receptionists about one of Sally's nightmares. Now, is this a breach of confidentiality? Well, you could say that the psychologist is telling the receptionist, who is inside that sphere of confidentiality in the clinic. Perhaps the psychologist is explaining how long she thinks the next appointment needs to run for follow-up or something. But the fact that Sally is in the waiting room, where presumably there are other patients, and she can hear the psychologist speaking, this is a confidentiality breach, because the psychologist is not being mindful of other people who could overhear this what should be a very private conversation between her and one of her colleagues to provide for optimal experience for Sally. Next situation is Armin, a third-year nursing student, who sees one of his patients in the queue at Chopin's Drug Mart. He pulls out his phone and updates his Facebook status to the following: "Lol, just saw one of my patients at Chopin's. Small world, huh?" Is this a confidentiality breach? This is a bit of a grey line, but I would say yes. Because how many patients were in the queue at Chopin's at that time who, went to the hospital or the clinic where Armin was working as a nursing student? That's a very, very hazy situation, but I think that you have the potential here for a confidentiality breach. So you want to be careful here, because this is an example of where you're not identifying a patient, or you're not breaching confidentiality per se, but you're giving enough information that a confidentiality breach could occur if somebody put the pieces together. Next one is Jasmine, a medical student, calls her mother at the end of her hospital shift and says, "I just helped to deliver a baby." Is this a confidentiality breach? No, not really, because Jasmine called her mother. Not saying that the family isn't inside the confidentiality sphere when we're dealing with patients, but so many babies are delivered, so many babies are born. She didn't say anything about any identifying information about which baby or which mother or the circumstances of the birth. It was just delivering a baby. So you can say that that should be alright, just because there's no identifying information. There's nothing to say who was the mother, who's the baby, who's the father, nothing like that. It's just a nice act that Jasmine wanted to share. Nikki tells you she is worried she might have AIDS because her boyfriend was just tested HIV positive. This situation could be a confidentiality breach. There's potential, but here right now, based on what we're given, I would say no. Just because it seems that Nikki is a friend who was telling you about her boyfriend. Neither you nor Nikki seem to have any confidential role, and you seem to be having just a casual conversation outside any kind of confidentiality understanding. In that case, I think we can say that there's no confidentiality understood here, which means there can be no breach. Finally, Jaime and Rosa are speaking while standing in a secluded corner at a party discussing a few problematic patients at the clinic. This most definitely has the potential for a confidentiality breach, because even though they are alone, they are in a presumably crowded place at a party and you don't know who's listening and who is hearing what you're saying. So you have to be very, very careful with those kind of things. That being said, thank you for your time. If you have any questions, I will be happy to answer them. And remember, confidentiality, patient information, subject information needs to stay top secret.